So the idea for New Limb, New Life is to help as many people as possible. This amount allocation is over a year, I think over a year to 18 months. The idea is to look at the cost for limb replacement. And I am not going to get involved in that. We're signing an MOU soon with the Disabilities Association. And we will hand them the resources because they have the knowledge and they will work with institutions like Sir John Golding.
Today we had a limb clinic where we saw patients who sustained amputations to their legs. They lost, for whatever reason, they lost their legs. What we found was that the majority of the patients who lose a leg is usually because of complications of diabetes. There are also some patients who lose it due to trauma, motor vehicle accidents, incidents like that. But more than 90% of the patients that we see in the limb clinic lose their legs because of diabetes, which is usually not properly controlled. Some of them actually do not even know they have diabetes until they end up in hospital and lose the leg. The Sir John Golding Rehab Center is the only public center that caters to persons with amputations. And when patients come, we assess them to make sure that the stump is in a proper state for fitting of a prosthetic limb. We also ensure that the other leg is in good condition because, particularly persons with diabetes, you want to make sure that they make the necessary adjustments to ensure that the diabetes is controlled to preserve the other leg. We also have to check on the lifestyle of the patient. We have to make sure that the patient doesn't have any other comorbid conditions. Some patients may actually also have hypertension and poor circulation. So even though they may lose a limb, unfortunately there are very few patients who may not be able to get an artificial limb because their heart is not strong enough to sustain it. Because to use a below-knee prosthetic, you actually exert at least 25% more effort to walk. So if your heart is borderline to begin with, you won't be able to manage a leg.
In my sectoral presentation recently, it's about 6 weeks ago, I announced a program called New Limb, New Life. And this came out of an analysis of the number of Jamaicans who have lost a limb, an arm, a leg, both legs, and an attempt at determining what caused them to lose their limb. And as Doc said here earlier, what we found was that 80%, Doc is saying 90% or more of the 300 or so Jamaicans who lose a limb each year, an arm, leg, two legs, lose them as a result of a non-communicable disease, and in particular, diabetes. We call it in Jamaican language sugar, just to be very clear. And diabetes creates complications. It creates complications in various forms, including poor circulation, which then leads to the life in that limb, that leg, becoming less sensitive, less active, and if you get a cut, it turns into a sore and it don't get better, etc., etc., and it can spread, which is why the limb is lost. So we wanted to reach out to those Jamaicans who have lost a limb. We know most of them are from diabetes, and many of them could re-engage society in terms of work, in terms of play, in terms of just being happy about their life, rather than being sad that they have lost a leg or two. And to give them a second chance, basically, based on their situation. And hence, we announced a $50 million Jamaican dollar support to the Disabilities Association, which is an agency under the Ministry of Labor, to support these patients who cannot afford to have a prosthetic leg or arm, a limb, who may have to subsidize in some cases, but at least they have a chance, a better chance, particularly those who can't afford it. And so what we're doing here today at Sir John Bowling is to tour, to meet some of these first beneficiaries of New Limb, New Life. First beneficiaries that will benefit from this support, and of course the doctors here who will carry out the procedure. This is the primary institution, Sir John Bowling, that deals with amputees. Without this institution, many people would not have options. And so we're happy that they are here and they're doing their work. Now, that is one aspect of the program, to give benefits to people like yourselves who are here. The other important aspect is to try to focus some attention around diabetes and to discourage the lifestyle that gives rise to diabetes. Because ideally we don't want so many people to be losing their limb, because we know the disadvantage it creates for them. So we are here to help you, but we're also here to tell a bigger story about diabetes and why diabetes is dangerous, and why lifestyle choices, the foods that you eat, the excessive alcohol, the stress, in some cases hereditary too, so depending on your lineage, who was your mother and father, all of those things are important, so that as Jamaicans we know how to prevent, if we can prevent it. And so this program is intended to do that while helping you and many others. But overall, I want to say today is the kind of soft launch of New Limb, New Life. We intend to carry the message far and wide throughout Jamaica, to promote healthy behavior, to reduce diabetes, to promote the signs and symptoms of diabetes so people get their health checks. And it ties in nicely with the Know Your Numbers campaign that we have launched, where we're giving free health checks across Jamaica. So I want to thank the staff, the leadership, the staff here at Sir John Bowling, the regional authority, for coming on board. I believe that they are equally seized with the importance of this initiative. They have helped me to develop, because they give me the data, they give me the attention, and they answer the questions that I can answer, because they are living it, they are seeing it every day. We are committed to helping Sir John Bowling in whatever way we can. We did some tours to look at things like ward expansion, some equipment for rehab, and so on. And in the coming days, weeks, months, we will do what we can. To you who are here, we just want to reassure you that we are here to help. We are here to give you an opportunity to re-engage life in as fulsome a way as possible without the disability of not having a limb. And we want to encourage you to follow the doctor's orders and advice in not having further limb loss or detrimental to your health overall or to your life. And also to tell your story where you can or where you feel inclined, to discourage other people. We live in a society where it's a free-for-all. We call this a free environment where people make choices, and we want to preserve and protect that. But we also want to help people to make good choices for themselves. And that's why the messaging is so important. So the idea for New Limb, New Life is to help as many people as possible. This allocation is over a year, I think over a year to 18 months. The idea is to look at the cost for limb replacement. And I am not going to get involved in that. We're signing an MOU soon with the Disabilities Association. And we will hand them the resources, because they have the knowledge and they will work with institutions like Sir John Bowling. The idea is to assess. The Ministry of Labour does provide some subsidy, and we will see to what extent, based on some means testing, what subsidy the patients can provide or contribution, and then we will add to that to complete the circle, the cycle. Where people just cannot afford it, we will accommodate them. So if you take the 50 million and you look at, I'm told 300 or so per year, maybe 100 afford it on their own, maybe another 150 can't afford it. It means that we boil down, these are who qualify now, because of the 300 I'm told about 75% of them qualify. Some don't qualify for limb. That's another important thing. as the doctor said earlier a while ago, depending on their condition and stage, life cycle stage, they may not qualify. So once a clinical analysis qualifies them, and you end up with maybe 100, 150 based on the trends, it's really now boils down to the means testing to determine who would need X amount, who would need Y amount, and who would need the full amount. So it's a target that is hard to determine. What I would focus on right now is the fact that we have the 50 million, and we're looking at 150 a year who would probably want some assistance, and we will assess and determine the amount as we go along.